Welcome to the Beverly Hills Plastic Surgery Podcast. This is Dr. Jay Calvert and Dr. Millicent Ravello coming to you from the 90210 to talk to you about a couple of things.
Yes, we are here today specifically to talk about implant removal because that's something we do.
Implant removal has become a thing.
It's definitely become a thing. I don't exactly want to go into all of the reasons patients have their implants removed, but there are definitely people who decide they are just done with their implants.
Sure.
They don't want them in anymore for various reasons. Maybe they had them in for a time and a season of their life and they aren't in that time and season anymore. Maybe they've been having complications, maybe recurrent capsular contracture, or they have a ruptured implant and they don't want to deal with them anymore. And they want them out. They're done with the implants and they don't want to deal with them anymore. So the issue always becomes, what do you do after you've removed the implants?
It's a big question because, here's the typical conversation. Well, I'd really like them to look like this once I get them out. I'm like,
yeah.
Yeah, well, those are breast implants. And when you take them out, they won't be there anymore.
They won't be there anymore.
They won't.
They won't. Okay, so a couple of things.
I'm always like, yeah, okay. I know.
I know what you want.
They look nice this way, but they want them out because they have other reasons that they want them out, which we're not getting into today. We've done it.
Yes. But
those podcasts exist.
Not today.
Go back, scroll through, look back. You will find the reasons that people have their implants removed. Not the topic of discussion today.
Correct.
This is, what do you do about it?
What do you do about it? And there are a couple of options that are available.
First, don't take them out.
Number one, don't remove them. Number two, replace them.
There you go.
Number three, way lower. Number three, just leave them out. Take them out.
That's it.
Close up the holes. Go about your day. Leave them out.
Let the breast settle.
Let the breast settle, and that's an option.
That is mostly what I do, by the way. Do you know why?
Can I get to number four?
No.
Okay.
Go ahead.
Can I go through my list?
No. I want to stop right. No, go ahead. Go number four. What's number four?
Number four, you remove them and do a lift, plus minus fat grafting.
Okay, let's go through your list again then, because that was a really nice list. But I was really excited to talk about the breast snapping back.
I know. There's
There's
also a number five. Can I say number five?
Wow. That's a lot of options.
A lot of options.
Okay,
Number five.
So what's number one?
Number one is
take them out.
Number one is don't take them out.
Don't take them out. Number two is
take them out and replace them.
Number three,
take them out, leave them out.
Four.
Number four, take them out, do a breast lift plus minus fat grafting. Number five, do a staged reduction of the implant. So if it's a saline implant, deflate it in the office. I know of some people that actually remove silicone implants in the office and then come back in a couple of weeks and decide what you want to do with the rest of the breast. So like a little staged approach. A little staged approach. Because this is the problem. The reason we've gone through this whole list is because the inherent problem that comes with removing implants is that the breasts have the potential of looking very deflated, and there's no better way to say it, but saggy. Saggy, deflated breasts. And usually, if you've had breast implants in for a decent amount of time, the breast implant has thinned the skin, it's thinned the breast tissue.
Oh, yeah.
Or if concurrently, you may have in the past 20 years, since you had them placed, gained a lot of breast tissue. It's not uncommon for women to put implants in when they're in their 20s with B-cut breast. Then they get older, they have kids, they go through menopause, and they get a lot of breast tissue. And now they're like D, double D, triple D breasts. So maybe you have way more breast tissue than you thought you had previously.
That definitely happens.
There's kind of an unknown, which is why if you have saline implants, or if you can somehow do a little test implant removal, it's nice because you can see exactly what kind of breast you're left with. And in some patients, it's not very much. And in some patients are like, oh, they actually have a decent amount of breast tissue. So it's sometimes kind of hard to know exactly how much breast patients have. Or we can kind of tell, but the patients can't tell or can't conceptualize what will be left behind. So there's the question of how much breast tissue is left. There's the quality of the skin. And there's the fact that once the implants come down or come out, the nipples could be